Bismillah ar-Rahman ar-Rahim. CBCT patterns of bone loss and clinical predictors for the diagnosis of cracked teeth and teeth with vertical root fracture. Study done by Ibrahim Alaugaily and Alaugaily Azim from the Division of Endodontics, University of Buffalo, New York. The aim of the study was to correlate and compare the location and position of longitudinal fractures associated with cracked teeth and teeth with vertical root fracture to the preoperative clinical and radiographic findings using CBCT imaging. They included 95 patients who were clinically diagnosed with either a cracked tooth or a tooth with vertical root fracture. Patients with crazed lines, fractured cusps, or split teeth were not included in the study. Information related to patients' age, sex, tooth type, anterior premolar or molar, and position, pulp and periapical status, presence and absence of sinus tracts, and the type of restoration was recorded. And the clinical assessment of the teeth included the probing depth, whether it's less than 6 millimeters or more than 6 millimeters. And the information regarding the fracture was listed in the clinical notes and confirmed with an intraoperative clinical photograph, and whether it was limited to the crown or extended to the root surface. The radiographic assessment of the teeth included both periapical radiographs and cone beam CT images. Two independent examiners were used to assess these images, and each root or tooth was examined to identify any unusual or unique bone loss patterns, and the bony patterns were categorized as follows: no visible bony defect, which shown in figure 1A in here, and the angular defect, which is a triangular bony defect as shown in figure 1B, J-shaped or halo defect as in 1F, the arrow points to the J-shaped lesion, and whether there was a combined or irregular bone defect, whether it was angular and J-shaped as a combined lesion as shown in figure J, or an irregular bony defect. And the figure C, D, and K shows the extent of the root fracture, whether it was in the crown or as shown in figure L, as it is extending towards the root. For the results of the study shown in the table, the mean age of the patients was 60 years, plus or minus 12 years as a standard deviation. Relatively older patients had the cracks and fractures, and there was a significant association between the presence of vertical root fracture and previously treated teeth with sinus tracts, and teeth with indirect restorations. On the other hand, cracked teeth were associated with direct restorations rather than indirect in the vertical root fracture cases. Amalgam was the most common restorative material found in cracked teeth, 52% of the cases, followed by the direct composite filling. 54 patients had full clinical and radiographic records of both cracked or vertical root fractured teeth, and 41 of the teeth were cracked teeth, and 13 were vertical root fractured. That accounts for 75%, 24%, almost 24% for vertical root fractures. And for the inter-examiner radiographic agreement, the result for periapical radiographs was near perfect, which accounts for a kappa of 0.89, and a perfect score of kappa 1 for the CBCT scans. And the study was conducted that the examiners would take a look at the periapical radiographs prior to the CBCT to eliminate any risk of bias. Angular defects were observed in 9% of the cases using periapical radiograph, compared to 46% of the cases when used in CBCT scans. Periapical radiograph shows evidence of bone loss suggestive of longitudinal root fracture in only 16%, whereas that's in periapical radiographs, whereas in CBCT imaging it showed the same finding in 72% of the cases. The cases of vertical root fracture were more associated with the absence of the cortical plate, a probing depth of more than 6 millimeters, and a J-shaped defect on the CBCT scan. CBCT scans had 4 times higher detection capabilities than periapical radiographs in cracked or vertical root fractured cases, and cracked cases were highly associated with angular defects, which can be used as a treatment predictor.